I'm Stephanie Zambitter. I'm a physical therapist at Gaylord Hospital. My role here is a clinical specialist in stroke. And so for today, we're going to be talking about staying healthy and preventing another stroke. When we talk about stroke prevention, we're going to kind of think to the American Heart and American Stroke Association and how they sort of break down stroke prevention, right? So we'll talk about, generally speaking, medical management, medication compliance, diet, and exercise. And I think before we continue into some of those, let's go ahead and review those controllable risk factors for stroke, which we learned in a prior video. Controllable risk factors for stroke are, once again, high blood pressure, obesity and physical inactivity, high cholesterol, stress, diabetes, coagulation problems. So how thick or thin is the blood, right? If the blood is too thick, it might put you at risk for developing a blood clot. If too thin, might put you at risk for a bleed, right? Smoking, cardiac arrhythmias, and substance use or abuse. Let's go back to our previous slide where we were talking about medication management. And this is a really important topic as we're beginning to talk about stroke prevention. And so if we think about those controllable risk factors that we just reviewed, it is perhaps conceivable that you may have had, let's say as an example, high blood pressure in your past medical history. Maybe prior to your stroke, you were taking medication. Maybe you were watching your diet. Maybe you were trying to exercise. Maybe you're doing all of those things, right? And so with respect to now and having had a stroke, it is very important that we sort of evaluate now your ability as a stroke survivor to manage your own medications. And this is done in a number of different ways here at Gaylord. The most important, of course, being your ability to know your medications, right? Know what you're taking and what it's for, of course. And this is handled, of course, in a number of different ways. We encourage our stroke survivors, when the nursing staff is bringing you your medications, that you ask what you're taking and what it's for. We encourage you, if something sounds unfamiliar to you, we want you to ask, is this different from what I was taking previously, or I used to take this? It's important as well that when your physician's coming around with you, that you ask questions about your medications if you don't understand what you're taking and what it's for, or if you have, we'll talk about this more in a little bit, some uncomfortable side effects that may be incurred from being on or trying a different medication. So medication management involves more than just knowing medications, though, right? It's also your ability to be able to safely take that medication, right? And so certainly not an issue when you're here in the hospital, right? We already know naturally that our nursing staff is bringing you medications, right? And we assume, of course, that you are taking those medications and then moving on with your day. And so we're going to fast forward to now you're home, right? Your ability to not only, again, know your medications, so what you're taking and what it's for, but your ability to sort of safely manage that task. And so that can include being able to read the label, right? We learned a little bit ago that a stroke can impact your ability to see, right? And so that might be difficult to read the label. Your ability to open the pill container, right? And so for many of us, that's a two-hand sort of function, right? And so it might be that when you're having your medications filled, you might need to swip or change to one of those flip tops so that you can manage that with one hand should you need to. Your ability to reach in and take that capsule or however that pill, whatever it may be, to place it into your mouth and then safely swallow, right? We've learned about how sometimes fine motor coordination can be impacted following a stroke, as well as one's ability to safely swallow medications, right? For some of you here right now, right, your medications are being crushed and either in applesauce or pudding or something of that nature, as opposed to just taking the pill whole and swallowing it with water or however you may have taken it previously at home. We also need to look at how memory can be impacted following a stroke. So your ability to know your medications, right? Know when to take that medication and have sort of an established way that you can remember that, and whatever tools you may use, and there are many, to help you with navigating that is a really important thing to consider. And so many of you will participate in what we call a medication management task here at Gaylord. That's an opportunity to work with the speech therapist or occupational therapist, perhaps both, on being able to demonstrate to the team that you understand your medications, right? So what you're taking and what it's for, and that you have a plan as to how to execute that task. That's a really important component of your overall recovery, particularly as we look at your ability to transition to home, right? And so For those of you that might be going home independently, you would need to be able to do this task then independently. For those of you that will be going home with assistance, and if not able to manage your medications independently, naturally then we would be wanting to train or discuss this with your caregiver or loved one or whomever may be assisting you at home. Medication compliance then is a little different, right? And so this is now making the assumption that you understand and know your medications, what you're taking, what it's for, right? And now sort of carrying on as far as the ability to take that medication as it is prescribed. And so we're going to talk a little about some of the barriers to compliance in taking medications. The first, of course, being cost. Naturally, again, not an issue while you're here in the hospital. We know, of course, that your nursing staff, again, is bringing your medications and you are taking them. But so we're going to fast forward to now being, again, home and having to obtain your medications sort of on your own. And so should you be finding naturally that a medication be too costly, you are encouraged, of course, to reach out and try to have some assistance if necessary in learning how to get your medications in a more cost-effective way. And this can be done in a number of different functions. As an example, some may opt to get their medications rather than on a monthly basis, on maybe a 3-month basis. Perhaps rather than going to your local pharmacy to pick up your medications, you may opt to get them online. It's knowing that there are different apps that you can use on your smartphone where you can enter a medication, and that medication will pull up as far as different costs in different areas or different pharmacies in your area so that you can be perhaps more cost effective in obtaining your medications. If cost happened to be a major issue with respect to being able to take your medications that are prescribed. And we should also be more specific here. I'm not talking, of course, about vitamin C and stool softeners and some of those things, but we're naturally, when we talk about medications and stroke, we're talking about those that are essential to prevention of stroke, right? So your blood pressure medication, any heart medication that you may be on, anything for cholesterol, diabetes, particularly for those of you that are new diabetics. So some of these things that are, again, quite important. And so it would be important naturally that you give some consideration to how you might be able to obtain them, and then also, if you need assistance from a cost perspective, that you have someone to help you with advocating, right, or reaching out to your pharmacist, your insurance company, and or your physician to help with navigating that path if it be that we need to make a change perhaps to a medication, right? Certainly that's why many of you are still here in the hospitals. We're learning about the medications and what you're taking. You have easy access, of course, to physicians while you're here in the hospital. Again, we're fast forwarding to now in that transition to home. In addition, from a compliance perspective, in addition to cost, many medications come with side effects. While you're here in the hospital, having that opportunity to share anything that you might be experiencing that you may not understand or certainly may be unpleasant. We all know that all medications come with side effects, some more tolerant than others. The idea being that should you be incurring a negative side effect from a medication, you are of course encouraged to discuss this with your physician so that you can make that change. And hopefully this is going on while you're here in the hospital, but once again, also important as you make that transition from hospital to home. Another compliance issue that many stroke survivors will experience, right, and it happens to all of us, that, I've been taking this medication for a really long time now, and I really don't think I want to take that anymore. I don't think I need it. I've been trying to make changes. I, really don't want this to happen again, and I've been doing all the things they've told me. I think I don't need that one anymore. And so we encourage you, of course, not to be your own physician, but to advocate for yourself and to perhaps make an appointment with your doctor or request to review your medications so that you might be able to at least make your needs known, right? Make it known that you'd like to understand what happens if I wish to come off of this medication, or what might that look like for me? So you can understand your risk and then make an informed decision or an informed choice. We're talking about diet and exercise in stroke prevention, particularly as they pertain to reducing blood pressure, cholesterol, and some of those things that from a prevention perspective in review of those controllable risk factors. This slide is very colorful and also very busy, so we're going to talk a little bit about kind of what we're looking at here. These are tips to control blood pressure. And so what we're looking at with the rainbow chart here is sort of talks about systolic and dystolic, which is that upper number of your blood pressure, and then the lower number. And then you see sort of that highlighted in the different colors, right? So green, yellow, the orange, and then the red. And so what you're looking at there are normal blood pressure. It says less than 120, less than 80. And I believe actually that the American Heart and American Stroke Association have actually lowered those numbers just a little bit. But those are reading as your normal range for blood pressure. And then what you're seeing as you kind of look down on that chart, right, and look at those numbers is elevated hypertension, right, and various stages of hypertension, and then crisis as far as 180 or greater than 180 and or greater than 120. What we're looking at that other chart there where it says 5 simple steps to control your blood pressure, that first one is a really important one. It says know your numbers, right? And so certainly while you're here in the hospital, your blood pressure is being taken fairly regularly with respect to the staff. And so now we're kind of fast forwarding to when you're home. The idea is that not that you necessarily need to take your blood pressure every 4 hours, but it is a good idea while you're here in the hospital to kind of become familiar with what those numbers are, particularly as your physicians may be making changes to your medication, right? And so that way, you know, if it's monitored in therapy sessions as well, your therapist can let you know, oh, hey, you know, it's looking pretty good or a little different than yesterday. And so you might start to become more familiar with the numbers that you're hearing. Number 2 there, it says make a plan. And this is another really important one, right? So making a plan involves discussion of medications with your physician, but it also an important question to be asking before you leave the hospital is, what's a safe range for my blood pressure, right? I want to know how high is too high and how low is too low. And that number may be variable or different for everyone, right? Depending upon, again, where your blood pressures fall and what your recommendations from your physician are as they look to kind of guide you with respect to that medication. Number 3 says make a few lifestyle changes, right? And so here we're going to be talking with you about perhaps your physicians are recommending either weight loss or a change to your diet. Many times if we're talking about dietary changes to control or help control blood pressure, we're talking about a reduction in sodium or salt intake. And so it might be recommended, right, that you follow up with a nutritionist or someone to help you with better being able to understand what foods you enjoy eating, right, and how to make I'll say acceptable changes, right, to your diet and what you're consuming. And this might also include being how to read a food label. It might include when you're going to the grocery stores, right, or your loved one is to be able to sort of know what foods run lower in sodium. And many grocery stores are trying to make changes now as far as identifying healthier food choices for folks. And so your local grocery store may offer the same. In addition to changes in diet, certainly it might be recommended that you exercise, of course. And so we're going to talk in a little bit about exercise recommendations for stroke survivors, but ultimately exercise should be monitored for a period of time after stroke, right? And so certainly while you're here in the hospital, you're having your blood pressure and your heart rate taken. Your therapist may be asking you about how hard you feel you're working, right? Or an RPE scale, the rate of perceived exertion, right? And so it'll be important that even as you make the transition out of hospital and to home, that you have someone working with you on monitoring your exercise tolerance and or activity tolerance. Number 4 here, it says keep checking your blood pressure at home. Some of you may be recommended to have a home unit to essentially check your blood pressure periodically, and you can find a number of those tools available on Amazon or other types of websites, essentially. You can ask your physician if they make a recommended one, and many of them are automatic, right? And it's just to kind of give you a range of blood pressure, right? And number 5, this is a real important one. We talked about this one earlier, right? And this one says to take your medications as they are prescribed. This particular slide is on tips to control blood cholesterol following a stroke. And so what we're talking about now is sort of the importance of knowing not only your total cholesterol number. Most of us have this number taken when we go for blood work, right, for an annual physical. Your doctors will send you for blood work. Many times they want that blood work fasting, and so that's they can get an accurate number for your cholesterol, right? But it's not only knowing the total number that's important, it's also being able to understand the breakdown of that number into separate values. We're going to talk about that just a little bit. That's the importance of knowing what your HDL values are. That's the good cholesterol, right? What the LDL values are. That's the quote unquote bad cholesterol, right? And then your triglycerides, okay? And so there's a ratio that may be calculated as well. And so your physicians, of course, are reviewing this with you, right? Hopefully, and helping you to gain a better understanding of what those numbers are. Sometimes they might be recommending for you to increase your HDL values, right? Lower those LDL, right? And that's important as we give consideration to, as I said, not only the total number, but also the breakdown of those values. And so an important thing to note, again, as we talk about leaving the hospital and transitioning to home, would be sort of asking your physician, right, what's an acceptable cholesterol, right? Some of you may be wishing to transition off of cholesterol medication. So it might be important for you as well to give some considerations from a dietary perspective as to what dietary changes can I make that would influence my cholesterol levels. Many times the recommendation that comes is essentially observing a diet that is low in saturated fats, trans fats, right? Increasing the amount of fiber in your diet, right? As well as including omega-3 fatty acids, which can be found in food form as well as in supplement form. And so some of you may be, again, recommended to speak with a nutritionist so that you can better understand how to make some of these changes, how to either include some of these foods either in their frequency and or total amount, right? And or where to find some of these in your grocery stores. Okay. This next slide is an important one when we talk about medication management, which we discussed a little bit earlier. And so what's before you here on the slide is just really a medication chart, not necessarily one that we endorse, but just to kind of give you the idea of having a way that you can keep track of your medications is, right, sort of the big picture, right? The importance of, again, knowing your medications, what you're taking and what they're for. Maybe even keeping record if you are changing a medication, keeping track of what side effects you might be experiencing. And that can be challenging if you're taking a whole bunch of medications, kind of knowing what does what. And so if you need assistance with being able to look up those medications online so you can understand side effects, it might be helping or having someone to help you with respect to best understanding what you might be experiencing. Some of you, prior to your stroke, maybe used a pill container, right? And so you already had an effective method by which you were able to keep track of your medications. Our staff and our team here will be looking to evaluate whether your previous methods, right, as far as managing your medications, will still be effective for you in having had the stroke. Good. The importance of staying active in stroke recovery is certainly well known to all of you, and many of you, of course, are already participating in therapies and already getting, you see up there 30 minutes 3 times a week. Well, we're getting therapy every day if you're here with us at Gaylord, right? And so the idea is that exercise and activity should be, of course, continued as you make that transition out of hospital and to home and or the next level of care. For those of you that already had a regimen of exercise and or maybe you've asked your therapist, right, for exercises that you can do at home, all of you will be recommended to continue with therapy in some form of capacity or another, and we'll get into that in a future video here. But ultimately, the benefits of exercise are essentially critical, right? And so we're talking about being able to improve your overall heart function, to lower your blood pressure, to lower your cholesterol, to have an improvement in your overall heart rate, right? To improve your strength, your balance, and your coordination. And from a mood perspective, to lessen the effects of depression and anxiety, which certainly can be very prominent following stroke and recovery from stroke. Some folks need some help with respect to getting started with an exercise program, right? Not all of us love exercise or love activity, some more than others, and we certainly know that. And so really, as you make that transition from hospital to home and working with your therapist on sort of what the next steps for you will be in your recovery, many of you may be trialing different types of machines or different things. And so feel free to ask your therapist, right, for what types of exercises might be beneficial for you. It's also important to give consideration to, from a safety perspective, right, what you're able to do, how your vital signs are responding. And I mentioned, I think in an earlier slide, that it's really important for a period of time after stroke, right, that you have your blood pressure and your heart rate monitored with exercise, right? So we're not encouraging you to go home and run to your local rec center or senior center, right? Jump on a treadmill and go to it, okay? How you will know that you no longer need that monitoring essentially is that you will ask your physicians for basically medical clearance to return to activities that you previously enjoyed prior to your stroke. So this is a really important slide here. We're talking about some of the cardiac warning signs. So these would be signs of exercise intolerance. I like the giant stop sign there. Chest pain. Okay, so here in the hospital, chest pain is an automatic stop for activity. And then, of course, we notify your nurse and your physician, and they'll take it from there as far as what the next steps may be. Okay, so obviously, if you're at home now and you experience chest pain with activity, that's an automatic stop for you. And again, we're going to encourage you to kind of call 911 and let them direct you as to the next steps. Right? Leg cramps, dizziness, wheezing, fatigue can all be signs of activity intolerance, right? Should you be experiencing them while you're here, of course, we want you to let your therapy team or your doctors know what's going on so that we can address it while you're here working with us. Fainting, that last one, I think that's pretty evident that obviously if we're fainting with activity, that's not good, right? Leisure activities after a stroke. And so really, one of the biggest things that we hope to work with you on while you're here is not only your physical goals in your recovery, those emotional aspects of your recovery, but also kind of who you were prior to your stroke, whether your goals are to ultimately in the long run return to work, or in the case of leisure, return to some previously enjoyed activities. It is one of our goals here to work with you on being able to get back into those things. There's a lot of research right now on salience in therapy, the idea that your participation in therapy matters, things that are important to you matter, and thus the motivation to kind of get back into those things. Many of you will work with our therapeutic recreation therapists on these types of activities, and so you'll have an opportunity to discuss with one of our clinicians ultimately the activities that you enjoyed and how those activities may be modified to help you with being able to return to whether that be sports you enjoy, reading, or any one of the cooking, any one of those number of activities. As part of our outpatient program, many of you perhaps will be engaged in our sports association, and so the therapeutic rec department offers a number of different activities that can be modified for those that are looking to get engaged in, whether that be cycling or tennis or any one of a number of different activities. And so for more questions, you can ask your therapeutic rec therapist. Thanks again for listening. I'm Stephanie Zandvetter. Please check out our other videos from Gaylord on stroke recovery.